My name is Jeroen Hendriks. I'm Professor of Cardiovascular Nursing, which is a joint position between the Central Adelaide Local Health Network and Flinders University. My research area is actually looking at developing novel models of care delivery for patients with atrial fibrillation, which is the most common cardiac arrhythmia, and associated cardiovascular conditions. And this is mostly done based on the concept of integrated care, which has four main pillars. That is a patient-centered approach, comprehensive care delivery, provided by a multidisciplinary team and supported by technology. So the research gap in this field is actually that it is increasing with age. So we're dealing with an aging population already, and it is also associated with cardiovascular conditions such as high blood pressure, sleep apnea, but also lifestyle factors like obesity, smoking, alcohol. And as we know, there's a lot of risk factors already in the population, so that really potentially leads to an increase of atrial fibrillation. I think one of the issues that we will have in the near future if we don't change to novel models of care is the capacity problems. So the prevalence of patients with atrial fibrillation and associated conditions will increase, while workforce issues, for example, nursing staff workforce issues, are still an important issue as well. So I think if we work all together, like in a multidisciplinary team, and divide the tasks, I think we will be able to tackle this pandemic, so to say. Within the integrated care approach, there's a multidisciplinary team focusing on that together with the patient. So we give the patient an active role. We educate the patient in their, managing their risk factors and their lifestyle modification. And then there's a nurse taking the lead in this approach, educating the patient, guiding them into their lifestyle modification and self-management. And a cardiologist, for example, or a general practitioner or a pharmacist will look over the shoulder and collaborate with the nurse, with the cardiologist and the patient and their carers. Well, I'm expecting, of course, that there will be improved outcomes, clinical outcomes in terms of hospitalization, healthcare utilization, but also mortality, so that is like the hard endpoints. But on the other hand, I think if we provide comprehensive treatment according to evidence-based guidelines and according to the preferences and the needs of the patients and having the patients on board, this will also lead to quality of life improvement in patients and satisfaction with the care received.